Welcome to the deep dive. We've got a mountain of material here on disaster nursing. Everything from, triage levels in the ER to
Uh,
bioterrorism preparedness.
oh, yeah.
So buckle up, because we are diving deep into the world of emergency
I
response.
love it.
We're going to uncover how ERs triage patients, what happens in those first few critical minutes when you arrive, and then we're going to kind of zoom out and look at disaster preparedness on a larger scale.
Awesome.
Get ready for some surprising insights. For example, did you know there's this specific cooling method they use after cardiac arrest?
Oh, wow.
It can dramatically improve outcomes.
Yeah.
We're going to get into that and a whole lot more.
It's fascinating how disaster nursing, it really begins in the ER. Like every day, nurses are making those split-second decisions that can mean, life or death.
Yeah, it's like this organized chaos.
Right.
I was reading about the Emergency Severity Index,
Right.
the ESI,
Yeah.
and honestly, it sounds pretty intense.
It definitely is. It's a 5-level system that helps ER nurses, quickly assess patients and determine who needs immediate attention. So just imagine a busy ER. The key question is, does this patient need life-saving intervention right now?
Okay, so someone in cardiac arrest,
Right.
having a major stroke, struggling to breathe, those are going to be top priority.
Absolutely, yeah. Those are level 1 cases.
Yeah.
Think of it as drop everything. This is life or death.
Wow.
You've got, CPR in progress, someone gasping for air, a stroke patient arriving by ambulance every second counts.
So then you have level 2, which is still urgent, but maybe not quite as immediately life-threatening.
Exactly. Level 2 patients need time-sensitive treatment but aren't in, immediate danger of dying.
Okay.
This could be someone, showing signs of a stroke,
Oh,
experiencing severe chest pain, maybe even an ectopic pregnancy.
yeah.
These cases, can't wait, but they're not actively, coding.
Yeah, okay. And then it goes down the line from there.
Right.
Level 3 being less urgent. So, if you've been having stomach pain for a few days, you're probably a level 3.
Yeah, those level 3 cases, they need attention and resources, but are less time sensitive. Think of things like persistent abdominal pain or swelling in your ankle after a long flight.
Mm-hmm.
They require care, but aren't life or death.
Mm-hmm.
And then level 4 and 5 are even less urgent, with level 5 being the maybe you should have gone to your doctor first category.
Right.
Yeah.
It's amazing how ER nurses can size up a situation so quickly.
Hmm.
And what about the legal side of things? What if someone comes in and they can't afford treatment? I remember reading about something called EMTALA.
Yeah, you're right. EMTALA is a huge deal in emergency medicine. It's a federal law that says hospitals have to stabilize anyone with an emergency medical condition, whether or not they have insurance or can pay.
Mm.
So if someone comes in with a heart attack, they can't be turned away just because they don't have a credit card on hand.
Wow. And there was this fascinating legal case, Lunsford v. Board of Nurse Examiners, that actually helped clarify the responsibilities of nurses in these situations, right?
Yeah, that case is really important for emergency nursing. It basically said that nurses have a duty to act in the best interest of their patients, even if that means going against hospital policies or procedures.
Oh.
Yeah. It really emphasizes, the independent judgment that nurses need to exercise, especially when someone's life is on the line.
Okay, so let's say you do end up in the ER. You've been triaged, you're in a room. What happens next?
Once you're in, the ER team, they kick into gear with a primary survey. It's all about, quickly assessing your vital functions. Think
Yeah.
A, B, C, D, E.
Okay.
Airway, breathing, circulation, disability, and exposure.
Okay.
They're making sure you can breathe, your heart's beating, checking for any obvious injuries, and controlling bleeding.
It sounds like a well-choreographed dance, everyone working together in sync.
Yeah, speed is definitely essential in those first few minutes, but thoroughness is just as important. So after that initial flurry of activity, they move on to what's called the secondary survey.
Okay.
Think FGHI.
Right.
This is where they get a full set of vitals, provide comfort measures, take a detailed history, and do a head-to-toe assessment to make sure they haven't missed anything.
So they're piecing together the whole puzzle, looking for underlying issues that might not have been obvious at first glance.
Exactly. Like, let's say you come in with a broken leg after a fall.
Yeah.
But during the secondary survey, they discover you also have a spinal injury.
Oh.
Yeah.
Yeah.
It's all about getting that complete picture.
When I was researching this, I came across this incredible treatment for post-cardiac arrest patients.
Mm-hmm.
It uses therapeutic hypothermia,
Right.
basically cooling the body down.
Yeah.
It seems like science fiction, but it actually helps protect the brain.
It's pretty remarkable. They use this special cooling device to lower the body temperature for 24 hours. And by slowing down the metabolism, they can minimize damage to the brain and improve the chances of, a good neurological recovery.
Wow. That's incredible.
Yeah.
It really highlights how much medical science has advanced.
It really has.
But sadly, not every ER story has a happy ending. What about those situations where, despite everyone's best efforts, a patient doesn't make it?
That's a heartbreaking but inevitable reality of emergency medicine, yeah. In those cases, the focus shifts to providing compassionate care and support for the family. Social workers get involved, organ donation organizations, but it's all handled with sensitivity and respect.
It's important to acknowledge that even with all the incredible life-saving technology and expertise, loss is still a part of the ER experience.
It is.
It must be incredibly tough for the nurses to deal with that emotional toll.
It absolutely is. And, hospitals have resources to help staff cope with the emotional stress of working in such a, high-stakes environment. But, let's broaden our perspective beyond the ER. Disaster nursing encompasses a wide range of emergencies, including those caused by environmental factors or, exposure to toxins.
This is where it gets really interesting. I was reading about heat stroke and how dangerous it can be if you don't recognize the signs early on.
Yeah, heat-related emergencies are a great example. It often starts with heat exhaustion. You're out working or exercising in the heat, and you start feeling dizzy, nauseous, and, extremely fatigued.
Right, and if you don't cool down quickly, it can progress to heat stroke, which is a life-threatening condition.
Exactly. With heat stroke, your body's internal thermostat malfunctions. Sweating stops, mental status deteriorates, and your core temperature, it just skyrockets. Rapid cooling is absolutely crucial to prevent organ damage and even death.
And on the other end of the spectrum, you have cold-related emergencies like hypothermia.
Right. Hypothermia is when your body temperature drops below 95 degrees Fahrenheit.
Hmm,
Older adults are particularly vulnerable because their bodies don't regulate temperature as effectively.
that makes sense. And then there are submersion injuries, which I think most people just call drowning.
Well, there's actually a distinction between drowning, which is fatal, and near drowning, where the person survives. But the treatment for both focuses on restoring oxygen levels and correcting fluid imbalances.
It's all about getting those vital functions back on track. Then you've got stings and bites, everything from snakes and spiders to dog bites and human bites.
Right. Treatment for stings and bites, it really depends on what got you. Antivenom is critical for venomous snake bites, while animal bites might require tetanus shots and antibiotics to prevent infection. And rabies is always a concern in some cases.
And we can't forget about poisonings, which can happen accidentally in the workplace or even recreationally.
Yeah. Poisonings are a complex area, and treatment varies widely depending on the substance involved. Sometimes it involves, inducing vomiting,
Oh, gosh.
administering activated charcoal to absorb the toxin, or even performing gastric lavage, which is basically pumping the stomach.
Oh, wow. That sounds intense.
Yeah, and sometimes they even use antidotes like Mucomist for Tylenol overdoses or hemodialysis to filter the blood in really severe cases.
So it's all about tailoring the treatment to the specific poison and the severity of the exposure.
Exactly.
But there's another critical aspect of emergency nursing we need to touch on: victims of violence.
Right.
This is an issue that often flies under the radar, but it's so important. We're talking about child abuse, elder abuse, and intimate partner violence.
Exactly. ER nurses are often the first point of contact for people experiencing violence. They're trained to recognize the signs, offer support, and connect victims with resources like social workers.
And in cases of sexual assault, they play a key role in carefully collecting evidence using forensic kits.
Yes.
It's a delicate and sensitive process, and the nurses are essential in ensuring it's done properly.
Absolutely. It's about providing compassionate care while also ensuring that evidence is preserved so that justice can be served. But now, let's zoom out even further and think about disaster preparedness on a larger scale.
Okay, so we're moving beyond the individual patient in the ER and looking at emergencies that affect entire communities. What's the difference between an emergency and a disaster?
That's a key distinction. An emergency is something that can be handled with local resources, like a car accident or a house fire. A disaster, on the other hand, overwhelms local resources. Think hurricanes, earthquakes, or even large-scale pandemics.
So a disaster requires help from outside, maybe even on a national level.
Exactly. That's where organizations like FEMA and the Red Cross come in. And nurses are a critical part of the disaster preparedness and response system. The American Nurses Association even has specific disaster competencies that nurses are expected to have.
So it's not just about knowing how to start an IV or read an EKG.
Right.
It's about understanding the bigger picture of disaster management. What are some of those competencies?
They cover a lot of ground. Nurses need to know their role in an emergency response plan, be able to recognize potential bioterrorism agents, and be vigilant in reporting unusual patterns of illness that could signal an outbreak.
So if a nurse starts seeing a bunch of patients with similar unusual symptoms, they need to sound the alarm.
Right.
It could be the first sign of something serious, like a bioterrorism attack.
Precisely. And to really illustrate this, let's take the Ebola outbreak as an example.
Okay.
It really highlighted the importance of having, interprofessional planning teams in place, involving everyone from infectious disease experts to communication specialists.
It's a reminder that responding to a disaster takes a village. Nurses are a vital part of that team. What were some of the big takeaways from the Ebola outbreak?
Well, we learned a lot from that experience. The importance of proper PPE training became crystal clear, as did the need for, realistic simulations to practice response protocols, like a dress rehearsal for a disaster.
And having clear communication channels and coordinating with EMS is also crucial, right?
Absolutely.
Yeah.
It's about creating a system where everyone knows what to do, who to contact, and how to get information quickly and efficiently.
Speaking of specialized facilities, I was fascinated to learn about the Galveston National Laboratory. They work on some pretty scary stuff there.
The Galveston National Laboratory is at the forefront of research on bioterrorism. They study some of the most dangerous pathogens in the world and work to develop countermeasures and treatments.
It sounds like something out of a spy movie. But let's bring it back down to the hospital level. I read about something called reverse triage. What is that all about?
Reverse triage is a fascinating concept. Essentially, it's about maximizing hospital bed space during a disaster. They do this by discharging patients who are stable and not expected to need critical care within the next few days.
So if a hurricane is headed towards the city, they might discharge patients who are recovering well from minor surgery to free up beds for potential casualties.
Exactly. It's all about prioritizing resources and making sure they're available for those who need them most.
It's a completely different way of thinking about patient care. And when we talk about disasters, we need to remember that they come in all shapes and sizes, both natural and man-made.
You're absolutely right. We have natural disasters like hurricanes and earthquakes, but we also have man-made disasters like terrorist attacks or industrial accidents. Nurses need to be prepared for anything and everything.
And out in the field at the actual disaster site, they use a special color-coded system for triage, right?
Right.
I'm picturing those little tags they put on patients in movies.
Yeah, that's right. It's a way for first responders to quickly assess the severity of injuries and prioritize care. Green tags mean minor injuries, like sprains or small cuts. Yellow tags are for more serious but not immediately life-threatening injuries, like fractures.
So green and yellow tags can wait a bit, while red tags need to be seen right away.
Exactly. Red tags are for those with life-threatening injuries requiring immediate intervention, like someone with a sucking chest wound or uncontrolled bleeding. And then, unfortunately, there are black tags, which are for those who are either expected to die or have already passed.
That's a grim reality of disaster response, but I guess those tags help ensure that resources are going to those who have the best chance of survival.
Exactly. The goal of triage is to maximize the number of lives saved. And it's interesting to note that military triage works a little differently.
Oh, how so?
In the military, the priority is getting troops back into action, so they might actually prioritize those with less serious wounds who can return to duty quickly. Civilian triage, on the other hand, focuses on saving as many lives as possible, regardless of their ability to fight.
So different goals, but the same basic principle of using triage to make tough decisions in a crisis.
Exactly. And there are a lot of resources out there to help nurses and other healthcare professionals prepare for disaster response.
Like what?
Well, the American Red Cross offers fantastic training programs, and so does CERT, the Community Emergency Response Team. There's also DMAT, the Disaster Medical Assistance Team, and Incident Command Training, which is essential for anyone involved in coordinating a disaster response.
These are all great options for people who want to learn more about disaster response and maybe even get involved in their communities. And I think that's a great place to pause for now.
Yeah, we've covered a lot of ground, from the intricacies of ER triage to the complexities of large-scale disaster response.
We'll be back soon with part 2, where we'll continue to explore the fascinating world of disaster nursing. Welcome back to our deep dive into disaster nursing. Last time we talked about how nurses are essential in the ER, making critical decisions every day, and how important preparation is when it comes to dealing with all sorts of disasters.
Yeah, that's right. We covered a lot of ground from those heart-stopping moments in the ER to the different types of disasters nurses might encounter.
Right. From hurricanes and earthquakes to bioterrorism threats, I'm really starting to grasp how diverse and challenging this field is.
It definitely is. And now I think it's the perfect time to delve into something that might seem straight out of a movie, decontamination.
Okay, decontamination. So we're talking about safely removing hazardous materials from people and equipment. I'm picturing those scenes with people in hazmat suits hosing each other down.
Well, you're not far off. Decontamination is crucial when you're dealing with things like chemical spills, biological agents, or even radiological contamination. It's about protecting both the victims and the healthcare workers who are helping them.
It sounds pretty intense. So let's say there's a chemical spill. What are the first steps in decontamination? Do they just rush in and start spraying everyone down?
Not quite. The first step is always assessment. First responders need to figure out what the hazardous material is, how far it's spread, and establish a safe perimeter.
So they're not just running in blindly, they're gathering information and making sure it's safe to approach the scene.
Exactly. Then comes the actual decontamination process, which
Mhm.
usually involves removing contaminated clothing and thoroughly washing the affected individuals.
So it's not always those dramatic full-body decontamination showers we see in movies.
Not necessarily. The method they use depends on the specific hazardous material involved. Sometimes good old soap and water are enough. Other times, they might need special solutions or equipment.
So it's about adapting to the specific situation. And I imagine that wearing the right protective gear is absolutely critical in these scenarios.
You're absolutely right. Healthcare workers involved in decontamination need to wear appropriate PPE, which could include respirators, gloves, and full-body suits. This protects them from exposure to the hazardous material while they're providing care.
It makes sense they need to protect themselves so they can help others. And decontamination isn't just about people, right? It also applies to equipment and the environment.
You get it. Anything that's come into contact with hazardous materials needs to be decontaminated to prevent further spread.
So if an ambulance transports a patient who's been exposed to a chemical agent, that ambulance needs to be thoroughly cleaned before it can go back on the road.
Precisely. And sometimes, if there's been a large-scale release of a hazardous substance, entire areas might need to be cordoned off and decontaminated.
It sounds like a massive undertaking. But now I want to switch gears a bit and talk about something that I think is often overlooked, the psychological impact of disasters.
You're right. The psychological toll of disasters can be just as significant as the physical injuries, even if it's not as visible.
Exactly. We tend to focus on the immediate casualties and the structural damage, but the emotional trauma can linger for a long time.
It's true. Survivors might experience anxiety, depression, PTSD, even survivor's guilt.
It's like an invisible wound.
And it's not just the survivors who are affected.
Yeah.
First responders, healthcare workers, even people who witnessed the event from afar can be impacted.
So it's like a ripple effect that spreads far and wide. And I imagine that children are particularly vulnerable in these situations.
Absolutely. Children might not have the same coping mechanisms as adults and might struggle to understand and process what's happened.
It's heartbreaking to think about. So what can be done to address the psychological impact of disasters? It seems like mental health support is just as important as medical care.
You're absolutely right. Providing psychological first aid, offering counseling services, and creating safe spaces for people to share their experiences are all crucial parts of disaster response.
And it's not just about providing immediate support, right? It's about ensuring access to long-term mental health care as well.
Exactly. The healing process can be long, and people might need ongoing therapy or medication to manage their symptoms. It's important to recognize that the psychological wounds of a disaster can be just as deep and long-lasting as physical ones.
Well said. So we've covered decontamination and the psychological impact of disasters. What other key areas of disaster nursing should we discuss?
Let's talk about mass casualty incidents, or MCIs. These are events that involve a large number of victims and often overwhelm the capacity of local healthcare resources.
Right, like a major earthquake or terrorist attack. Those are the situations that really test the limits of our healthcare system.
Exactly. In these situations, triage becomes even more critical. Remember that color-coded system we talked about earlier? It's used in the field to quickly assess patients and prioritize care based on the severity of their injuries and their likelihood of survival.
So, those with the most life-threatening injuries, the red tags get treated first. It's about making those incredibly tough decisions in the heat of the moment.
It's a difficult reality of MCIs. But the goal is to save as many lives as possible, and sometimes that means making heartbreaking choices.
And communication must be absolutely essential in these chaotic situations.
Communication is key. First responders, hospitals, and other agencies need to be able to communicate effectively to coordinate care, share information about resources, and avoid duplicating efforts.
It's about everyone being on the same page and working together seamlessly towards a common goal.
That's where Incident Command Systems, or ICS, come in. These are standardized frameworks for managing emergencies and disasters. They help streamline communication, delegate responsibilities, and ensure a coordinated response.
So it's like having a clear chain of command and a playbook for how to handle an MCI.
Precisely. Incident command training is crucial for anyone involved in disaster response, from nurses and paramedics to law enforcement officers.
It's about speaking the same language and knowing who's in charge of what. Now let's talk about something that I imagine is a heavy burden for disaster nurses: ethical dilemmas.
Ah, yes. Ethical dilemmas are an unfortunate but unavoidable reality of disaster nursing. When resources are scarce and the needs are overwhelming, healthcare workers are often faced with incredibly difficult decisions.
It's those impossible choices, like deciding who gets the last ventilator or who gets evacuated first. It must be incredibly stressful for those making those calls.
It is. There are no easy answers in those situations. But there are ethical frameworks and guidelines that can help guide decision-making in those, high-pressure moments.
So it's about having a set of principles to lean on when you're forced to choose between two bad options.
Exactly. And it's important for hospitals and healthcare organizations to have policies in place that address these ethical dilemmas and provide support for staff who are wrestling with these tough choices.
It's recognizing that these are not decisions that anyone should have to make alone. There needs to be support and guidance available.
You're absolutely right. It's also crucial to debrief after an MCI to discuss what went well, what could have been improved, and to provide emotional support for everyone involved.
It's about learning from each experience and applying those lessons to future events. Another aspect of disaster nursing that's rapidly evolving is the role of technology.
Oh, yeah. Technology is changing the landscape of disaster response, and nurses are at the forefront of this evolution.
So we're not just talking about bandages and stethoscopes anymore. We're talking about high-tech gadgets and digital tools.
Exactly. We're seeing things like mobile devices used to collect and transmit patient data from the field, telehealth platforms that allow doctors to consult remotely with patients in disaster zones, and even drones delivering medical supplies to hard-to-reach areas.
It's amazing how technology can bridge the gap between those in need and those who can help, even in the most challenging circumstances.
It truly is. And we can't forget about social media. During disasters, it can be a powerful tool for sharing information, coordinating relief efforts, and connecting survivors with their loved ones.
It's a way to build community and support in the aftermath of a disaster. But I imagine that using technology in these situations also comes with its own set of challenges, right?
Of course, data security and privacy are major concerns. Maintaining communication networks in disaster zones can be difficult, and there are disparities in access to technology that we need to address.
Right. Not everyone has a smartphone or reliable internet, and those disparities can make the impact of a disaster even worse for vulnerable populations.
You've hit on a crucial point. As we integrate technology into disaster response, we need to make sure it's being used fairly and that no one is being left behind.
It's about using technology as a tool to enhance our response, not to create further divisions or inequalities.
Exactly. As we wrap up this part of our deep dive, it's striking how broad and complex the field of disaster nursing really is.
We've covered a lot of ground, but there's still so much more to explore. In part 3, we'll dive into some specific examples of disasters and the lessons we've learned from them. We'll examine how nurses have responded to these events, the challenges they faced, and the incredible innovations they've spearheaded. So stay tuned. Welcome back to the deep dive. So far, we've really dug into the world of disaster nursing, from the ER to bioterrorism, from decontamination to the emotional toll these events take. But now, in this final part, I'm ready to see how all of this plays out in real-life disasters.
Yeah, it's fascinating to examine specific events and see how these concepts we've been discussing actually translate into action on the ground.
Exactly. So where should we start? There have been so many devastating events throughout history.
Well, let's go back to 2005 and Hurricane Katrina. The way it devastated the Gulf Coast, especially New Orleans, was a real wake-up call about the gaps in our disaster response system.
I remember those images vividly. The flooded streets, people stranded on rooftops, hospitals completely overwhelmed. It was a stark reminder of how powerful nature can be and how vulnerable our infrastructure is.
From a nursing perspective, Katrina really highlighted the need for clear communication protocols, surge capacity planning, and for nurses to be incredibly adaptable and resourceful in the face of chaos.
Right, because in those situations, you can't always rely on having all the equipment and resources you're used to in a regular hospital setting.
Exactly. Nurses had to make do with whatever they had, get creative with treatments, and prioritize care for the most critically ill patients. They also played a vital role in providing comfort and support to people who had lost everything.
It speaks volumes about their dedication and resilience. What about the aftermath of Katrina? I imagine the recovery process was just as demanding.
Oh, it was a long road to recovery. Nurses were involved in all aspects, providing basic medical care, assisting with rebuilding efforts, and addressing the long-term mental and emotional health needs of the community.
So it wasn't just about the immediate response, but the long game of helping a community heal and rebuild. Did we learn any valuable lessons from Katrina that have shaped our approach to disaster preparedness today?
Absolutely. The communication breakdowns and lack of coordination that happened during Katrina led to some major changes in how we manage disasters now.
Like what specifically?
Well, for example, the National Incident Management System, or NIMS, was put in place to create a standardized framework for disaster response across all levels of government and organizations.
So it's about creating a more unified and coordinated approach, making sure everyone's on the same page and working together effectively.
Precisely. We also saw a big push for improved surge capacity planning. Hospitals started developing strategies for quickly expanding their capacity to care for a sudden influx of patients.
Because in a disaster, you never know how many people will need medical attention. You have to be prepared for the worst case scenario.
Exactly. Now, let's shift our focus to another major disaster, the 2010 earthquake in Haiti. This event really brought to light the unique challenges of providing medical care in a resource-limited setting.
The images from Haiti were truly heartbreaking, widespread devastation, countless injuries, and a healthcare system that was already struggling before the earthquake hit.
It was a massive test for the global community. Medical teams from all over the world rushed to Haiti, bringing much-needed supplies, expertise, and a willingness to help in any way they could.
And nurses were right there on the front lines, providing care in makeshift hospitals and clinics, often working around the clock in incredibly difficult conditions.
Absolutely. The Haiti earthquake really underscored the importance of cultural competency in disaster nursing. To provide truly effective and compassionate care, you have to understand the local customs, beliefs, and language barriers.
You can't just assume that what works in one culture will automatically work in another. It's about being sensitive and respectful of the community you're serving.
Precisely. The Haiti earthquake also highlighted the importance of partnerships and collaboration in disaster response. No single organization can handle a disaster of that magnitude on its own.
It takes a village, right?
Exactly. It requires governments, NGOs, international aid organizations, everyone coming together and working towards a common goal.
It's a reminder that we're all interconnected and need to support each other, especially during times of crisis. Now, I want to touch on a more recent disaster that has impacted all of us, the COVID-19 pandemic. This has been a global health crisis, unlike anything we've experienced in recent history.
The COVID-19 pandemic has been a defining event for our generation. It's really put our healthcare systems and our resilience as a society to the test.
And nurses have been at the very heart of this crisis. They've been working tirelessly on the front lines, caring for patients, administering vaccines, advocating for public health measures. They've truly been the backbone of our response.
They have. And they've faced extraordinary challenges, shortages of PPE, overflowing hospitals, and the constant fear of being exposed to the virus themselves. Yet they continue to show up day after day, putting the needs of their patients first.
It's incredibly inspiring to witness their dedication and selflessness. And hasn't the pandemic also pushed healthcare innovation forward? I'm thinking about things like telehealth and remote monitoring.
Absolutely. COVID-19 forced us to completely rethink how we deliver healthcare. We had to embrace new technologies and approaches to expand access to care, and I think many of these innovations are here to stay.
It's a silver lining in a very difficult situation. As we wrap up our deep dive into disaster nursing, I'm just in awe of the bravery, compassion, and resilience of these healthcare professionals.
They truly are heroes, running towards danger when most people are running away. Their work is a testament to the strength of the human spirit in the face of adversity.
And while we hope that disasters become less frequent and less severe, we know they're a part of life.
Which is why it's vital that we support our nurses, invest in disaster preparedness, and work together to build stronger, more resilient communities.
Because when disaster strikes, it's our collective response that will determine how we weather the storm and how quickly we can recover.
Well said. And with that, we've reached the end of our deep dive into disaster nursing. Hopefully you've gained a deeper understanding of this complex and challenging field and the crucial role nurses play in keeping us safe.
Thanks for joining us on the deep dive. Stay curious, stay informed, and stay safe out there.